name's Kirsten. I'm going to be your nurse today.
Hey, Kirsten.
And are you able to tell me your name and date of birth?
Sure. It's Nick Dunn, April 1st, 1988.
Awesome. So I understand you're here because you're not feeling very well, but if you could just, kind of tell me what's been going on and the symptoms that you're having, and we can go from there.
Sure, yeah. So for a little bit now, I'd say for at least the better part of a day, I've had a temperature. I think it's a fever. It's like 102 or something like that. I've been just feeling significantly fatigued, a lot of aching and stuff everywhere. It was even kind of difficult to get in here today, just in general. It's been kind of difficult to breathe, and I'm never sick, so this is kind of, alarming to me. So I was hoping to learn more about what might be going on.
Okay, awesome. Just to get some background info, was there anything like in your normal day-to-day life that happened in the last few months, or anything that could have brought this on, or that you can think of? Do you get normal allergies, or do you have a job that exposes you to a lot, or anything like that?
Yeah, as a matter of fact, I was thinking about that too. I do work in a laboratory setting.
Okay.
I work on a lot of biological material. And there was a mishap recently where I got stuck with a needle. I didn't think anything of it for some reason, even though I know that there's, as far as needles are concerned and contamination, that it's a super high risk.
Sure.
But otherwise, I'm a really safe person. So I guess now that I'm thinking about it, that would probably bear some significance here.
Okay, well, we will all move on with your assessment and just see what we find, and then I'll speak with the doctor, and we'll see what labs we want to run and what we want to do from there, okay? Hi, it's me again. Can you give me your name and date of birth one more time?
Yeah, it's Nick Dunn, April 1st of 88.
Awesome. So just because of some of the symptoms you were telling me earlier, you're having a hard time breathing, you're feeling really fatigued, I'm just going to do kind of an abdominal assessment, check out your respiratory system, see how it's sounding, and then I'll chat with the doctor and we'll go from there, okay?
Yeah, sure, no
Awesome.
problem.
So what I'm going to do first is check your lung sounds, okay?
Sure.
I'm going to lean this bed back a little bit.
Okay.
And I'll have you take a deep breath every time you feel my stethoscope on your chest, okay?
Sure.
And then is it possible for you to turn your head that way for me, and I can just assess your neck here? Awesome. Thank you so much. And if you can take a seat, sit up for me a little bit, and I can listen to your back.
Sure.
And then again, just take a deep breath every time you feel my stethoscope on you, okay?
Sure.
Okay, thank you so much. You can relax. So I am just hearing a little bit of crackling in there. I can tell that you're having some trouble breathing, so I definitely will go over that with the doctor when I meet with him.
Sure.
I'm going to lay you back down, and I'm going to do some just an assessment of your abdomen because you did report some diarrhea and stuff. I just want to make sure that everything sounds okay in there.
Sure.
So we'll have you lay completely down.
Yep.
And I'm just looking at your skin. It does look a little bit pale. I know you reported a fever, so are you feeling clammy at all, or kind of
maybe.
temperature changes in your body or anything
Temperature
like that?
change for sure, but
Yeah.
I'm not sure about clammy.
Okay, sounds good. Well, I don't see your abdomen isn't distended at all. I don't see any signs of like lumps or bumps or bruising in there. So the next thing I'm going to do is I'm just going to listen.
Okay.
Awesome, thank you so much. And then I'm just going to feel around, and you let me know if anything is painful or hurting you in any way, okay?
Okay. So far, so good. Oh.
Awesome, thank you so much. Okay, so I am done with your assessment. So I'm going to sit you up, and at this point I'm going to go over with the doctor and the pharmacist kind of what's going on, what we're seeing. We'll run some labs that they think we should, and then we'll go from there and get you set up for your next appointment, okay?
Sounds good.
Thank you.
Thank you.
Hi, doctor. So I met with Nick. He's our new patient, and I just wanted to go over my findings and kind of discuss with you what you think we should do moving forward. So I did take his vital signs. His blood pressure looks good, which is good. But also, so I was a little concerned about his O2. He's only coming in at 90%, and he did report some trouble breathing and some fatigue lately, just kind of overall kind of flu-like symptoms almost. And he does still have a fever. He has a fever of 101.2 that he has reported he has had for about a week now. And he did report that in his work life, he works with a lot of different, he works in a lab with, blood and bloodborne pathogens that are being processed from like IV drug users and things like that. So I thought that might be a concern. He said he was pricked at one point about a month ago, but nothing really came of it, and now he's having these symptoms. So I just wanted to see what you wanted to do there. As well as when I was listening to his lungs, I heard some crackles in there in the lower left quadrant, and some enlargement of the lymph nodes in his neck as well. So anyways, he also reported some diarrhea that he's been struggling with again since his symptoms have kind of flared up in the last week or two. So anyways, I was looking to see what your recommendations would be, what you wanted to do moving forward, and what you wanted to investigate.
Okay, so when you did your assessment, you didn't see any signs of jaundice, correct?
Not really. His skin was pale, but not yellow.
Okay, and you didn't detect any right upper quadrant tenderness?
No.
Okay, that's good. And you did notice crackles in the lung, so that's of primary concern. We want to find out what that infection is. So he needs a chest x-ray to see if it's pneumonia or not. We need to give him a flu test to rule whether it's flu or not. But it's very concerning that he was pricked and could have acquired a bloodborne pathogen. So it doesn't sound like hepatitis B or C, but we do want to do a blood test for those bloodborne pathogens.
Okay.
The swollen lymph nodes combined with the diarrhea and what may be pneumonia is very concerning. So, and the fact, of course, that he worked with blood that may be infectious with a bloodborne pathogen leads me to want a HIV test. There's 3 HIV tests that we need to check. We need to check his CD4 levels. We need to check the ELISA test for HIV antibodies, and we need to do the HIV RNA assay, and what that will tell us if there's any circulating HIV virus in his blood.
Okay, awesome. Sounds good. Well, I will get those ordered and speak to the pharmacy, and we'll go from there.
Okay, sounds great. Thank you.
Awesome.
Hi, Nick. Hey, I'm Jeff, your doctor. We've met before. I've brought the pharmacist.
I'm Lynn.
Hi. She's going to talk about some therapy. I've got some bad news, but I have some really good news as well. The bad news is we did the HIV RNA assay, and we did detect HIV in your bloodstream. That means you are infected with HIV, and most likely this will be an infection that will last your entire lifetime. But the good news is HIV is not a terminal diagnosis. AIDS is a terminal diagnosis, but HIV is not a terminal diagnosis.
Okay.
Also, we tested your CD4 levels. CD4 helper cells are a critical component of your immune system. They were above 1,000. That's normal, and that's where they should be. And as long as you follow drug therapy, they'll stay that way for your entire life.
Awesome.
So,
okay. Silver linings are good.
Yes, you do want to take your drugs and not miss a dose because we want to keep the viral load low.
Sure.
The pharmacist will talk more about it. Another thing that I noticed was that you don't have HIV antibodies in your bloodstream yet. That means that it has not seroconverted, and that is likely because you acquired the HIV virus from the prick that you got at work, and it's an acute infection. That means that this is where we want to find the infection if you're going to be infected. Of course, it's better if you would have never been infected, but since you were acutely infected, we can keep your CD4 levels where they need to be.
Okay.
So I'll let Lynn talk about the therapies that are available. And
Okay, Nick, you're going to be in a drug therapy. It's called HART. So it's a highly active antiretroviral therapy. So this drug will consist of 4 groups of medication. So the first one is called protease inhibitors, what it does literally is going to prevent the HIV virus and fuse with your cell. So the second drug is called CCR5 antagonist. So this drug will kind of help to prevent the HIV virus from entering to your cell. And the third drug is called the integrase inhibitors. And this drug, it will kind of prevent the viral DNA to be integrated with your own DNA. And the last drug is called the nucleotide reverse transcriptase inhibitors. So what this drug does is, since HIV is a RNA virus, so it helps to prevent the RNA converting to DNA. Once it's converted to DNA, it kind of give your own cell some instruction and kind of use your own cell, especially CD4 cell, as like a manufacturer to produce more viral DNA inside of your cells and leave your own cell to die.
Sure.
So this is also a critical, CD4 cell is a critical component of your immunity. So what this drug does is try to preserve as much CD4 cell as possible to help you to preserve your own immunity.
Okay, I think that makes sense. It lines up with what the doctor said. So basically, multiple drugs to kind of mitigate the whole process from happening in the first place, to slow it down. Does that sound accurate?
Yeah.
Right. So the HIV virus is highly mutable.
Yeah.
So we want to keep the viral load low.
Sure.
If the viral load gets high, it can mutate, and then that can cause it to get past some of these countermeasures that we have pharmacologically. At that point, we would have to change the cocktail. It's always 3 or 4 drugs, and there are different drugs out there, but we want you to take your drugs every day. So make sure that you have some sort of, like a weekly or a monthly drug counter that you can sort of pre-sort your pills, so that you don't, get into, taking 3 or 4 drugs and then taking a drug in the morning not knowing if you took it or not. So
Yeah. I guess my only other concern would be looking in the future, if I want to have kids or something, what would that look like as far as preventative measures are concerned?
So I don't think that's really realistic to have kids in the future, but you still can practice, safe sex. Like if your partner, she's going to take a pre-exposure prophylaxis drug. So this is an antiretroviral medication that is used in like people who have a very high risk to expose to HIV.
Right.
So this is a combination of drug that need to be taken like daily on the same time. But at the same time, you guys also need to use a condom though.
Okay.
And so your partner probably will have to follow up with her provider like every 3 months.
Okay. Gotcha. Okay, well that's a lot, but I think it makes sense. So I appreciate you going through that with me.
yeah, so you know the difference between HIV and AIDS. HIV infection, of course, is whenever you have the virus, but as long as your CD4 cells are above 1,000, or in that range, you will be healthy. And that's what the drug therapy is designed to keep you at throughout your entire lifespan.
Gotcha.
When the CD4 levels fall below 200, that's when it becomes AIDS, and that's when it's a terminal diagnosis.
Gotcha. So that's probably the reason I'm sick now, huh? Is because.
No, you have an acute infection.
Okay.
It will go into a latent mode, and then as you take the drug therapy, you should remain healthy.
Okay. Great. All right. Well, I don't think I have any more questions.